Hi, today's educational and counseling presentation is entitled Group Therapy for Parents of Children with Autism. The purpose of this presentation is to help guide you in the development and implementation of a therapeutic and growth group for this unique community. The structure of today's presentation includes, first, for many of you will be a review of the characteristics of people with autism spectrum disorder, or ASD. What is slightly different here is that I'm going to ask you to keep in mind your own reactions to this information, asking yourself what it might feel like to have a child with these characteristics. How would this affect your day-to-day life? How would it change your life? Would it change your life? It's extremely important to have at least a general idea of the challenges and rewards the parents face when living with and supporting their family members with ASD. We'll then examine the particular stressors related to this experience as reflected in research and why group therapy is an appropriate and beneficial approach for this population. Finally, I will propose a structured group therapeutic model and discuss the special considerations particular to the community and review the overall structure of the group. It's important as we begin to look at the characteristics of ASD that we note that the language used in such terms as symptomology and deficits is a heavily medicalized model of understanding of differences and challenges. My goal ultimately in discussing the group therapeutic approach is as a productive tool for parents in a way to assist them with their own mental health and well-being issues so that they can also experience the strengths and positive qualities of their children and of themselves. We can understand ASD as a neurodevelopmental difference, specifically in the areas of social interaction, communication, and behavior. And it is also important to remember that this is a spectrum disorder, meaning that each individual with ASD is unique, and there is a wide variation in the symptoms and severity of all ASD criteria. One way to specifically conceptualize ASD is through the lens of the DSM-5 diagnostic criteria, which include what are termed deficits in the areas of social interaction and social communication, as well as restricted and repetitive behavior. On this slide, we're looking at what is often called or can be called the heart of ASDs. That is the inability or deficits that impact relationships with the world. It really has to do with the ability of people with ASD to engage with others. Social emotional reciprocity refers to the way in which a person is able to interact with another person, how they influence, and how they are influenced by their involvement in a relationship. It's that dance that we have to do with understanding and sharing social and emotional experiences. This disorder can greatly impact the sharing of emotions, interests, the ability to initiate or respond to social interaction. Nonverbal communicative behavior refers to a range of problems with nonverbal communication. This can go anywhere from the relationship between the integration of verbal and nonverbal communication through problems with nonverbal skills such as the use of eye gaze and gestures or facial expression, understanding both receptively and expressively. Adjusting behavior to fit social situations is another area affected where the ability to make and maintain relationships is compromised. And I included social cognition on this slide because I felt that it was an important way to think about this disorder. And it really has to do with the impact deficits related to perspective taking and self-awareness. Issues related to these skills, again, have significant repercussions in the way that we interact with the world. Another core area attributed to ASD is in behaviors that are described as restricted or repetitive and rigid. Here we see motor or verbal behavior that is repeated again and again, such as words or phrases, the lining up of toys, jumping or twirling. It's the need to have a set routine or pattern of behaviors, and an intense interest in specific subjects or objects, and a very high or abnormally low sensitivity to sensory input in the environment. That is, one is either profoundly impacted by sounds and tastes, for example, or has a low sensitivity to those types of inputs. Inflexibility and rigidity may be manifest when we see individuals who have who have trouble transitioning or changing or responding in the moment to anything that might be outside of the routine and pattern of their lives. ASD is an early onset disorder, meaning that we start seeing symptoms in early development. Typically, this would be in the second year of the child's life. However, it might be recognized earlier than that, especially when a lack of social interest is observed. Sometimes learning coping strategies can also mask the presence of these challenges. And in terms of functioning, it's important to realize that these deficits are likely to affect not only the relationships closest to us in earlier ages, for example, the family and school functioning, but later in life, such as work, housing, accessing transportation, etc. There'll likely be areas in which people with ASD will require some sort of support. ASD does frequently co-occur with intellectual disability, but not always. And understanding the intellectual and social functioning can be a difficult issue. There are also associated medical conditions for individuals with ASD as well, including genetic disorders, gastrointestinal problems, seizure disorders, sleep dysfunction, sensory processing problems, and pica. What's significant about this is in terms of actually being able to provide assistance, but sometimes behaviors can be impacted by these co-occurring medical conditions, especially when pain is involved. So the impact to parents. Well, we know from research that there are higher levels of parent-child related stress and decreased sense of self-efficacy for parents of children with ASD when we compare them to children without delays. But I think what's equally interesting and perhaps more profound is that this community of parents also experiences levels of stress at higher rates and decreased sense of self-efficacy when we compare them to children with other types of developmental delay or with other special health care needs. Negative emotions that are associated with this experience also cumulatively over time can have a very strong impact and lead to increased risk of parent anxiety and depression. So, what are the sources of stress for parents? Well, this again brings us back in reflection to what the characteristics are of ASD are. And they can include pervasive disruptive behaviors, that is, the rigidity that I spoke of before, the difficulty with adapting to the changes that all of us experience in life and in our families, certainly, demandingness and distraction. Verbal expressive difficulties can create real stress between relationships with parents and children. The child's uneven intellectual profile. Obviously, well, perhaps not obviously, but the severity of the impairment may predict the stress level, meaning that the higher the severity or the assemblage of symptoms, the higher stress levels that parents do experience. And the aspect of long-term caregiving is very important to consider because these are children who are likely going to require some sort of a support throughout the lifespan. Parents, therefore, are going to be responsible on some level for providing that support. There are economic stressors related to this experience as well. There absolutely are substantial costs related to having a child with ASD. Some estimates are over $17,000 per child annually. And some of this financial commitment is taken care of by social support systems such as Medicaid and or the educational system. However, families with ASD still face significant challenges in their own economic health. Mothers of children with ASD earn about 35% less than mothers of children with other health limitations. And about 56% less than mothers of children with no limitations. So there's a direct effect on especially mothers in the workforce with children with ASD. So what are the implications for their children when their parents are highly stressed? Well, for all children, but especially children with ASD, there is an expectation that parents will be participating vigorously in their child's treatment plans and intervention plans. When the parent is experiencing an extreme level of stress, this then is threatened, the ability for the parent to actually participate meaningfully in their child's education. Parent-mediated interventions are a major component of the intervention delivery, which simply means, as I was saying, that the parent's role is a significant role in the child's education. And in order to have quality and consistency in their treatment outcomes, we need to see parents that are in good mental health and psychological well-being. So poor adherence to intervention and it causes a decreased effectiveness of teaching interventions. And we know that when parents and children experience a higher level of synchronization, basically are tuned to each other and are fitting well, that this can help with joint attention and language development for children with autism spectrum disorder. We also know, especially when we look at this from a family systems approach, that parental well-being affects the entire family, marriages, siblings, extended family. And within the community with children with ASD, there are high rates of divorce, and researched statistically, it is found that there are lower overall family well-being. So what can we do? Well, much of the work that is done really focuses on behavioral techniques to enhance communication with children, but that does not necessarily focus on the psychological distress or well-being of the parent. We do know that parents show great resilience through a wide variety of coping mechanisms. And psychological support, particularly in groups that include other parents who have children with ASD, has been found to be highly valuable. So why is it important to provide group support? Well, one of the most challenging pieces in the lives of parents who have children with ASD is the difficulty in maintaining social support. They often feel isolated and marginalized. And we know that the more stress that is felt, the greater increase of that isolation, especially when social support has been decreased. When we find that we have less friends, or when family members, for whatever reason, are not able to provide support. When the experience of having the child with ASD itself is so particularly different from parenting neurotypically developing children, the parents again feel isolated and really bereft of that kind of support that they need. So the relationship between stress and the negative outcomes actually can be improved by increasing social support and increasing diversity of coping styles. So when working as counselors and with parents, we want to discourage them from using escapism and avoidance as a coping strategy. And really, we want to help to provide parents with the skills to use to find more appropriate coping styles and to actually seek out social supports rather than deny their need for this kind of support in their lives. Well, that leads us directly, right, to group therapy as an intervention. I love this quote by Irvin Yalom. There is no better antidote to isolation than deep therapeutic engagement in the group. We know through time and research that there are many benefits to group work, that it can reduce stress, depression, and loneliness, and actually increase hope and self-esteem, that it can improve problem-solving abilities. And this is in particularly, I think, important with this community. Um, the feeling of self-efficacy can really be related in learning how to solve problems better. And once that's approached, and I think that once self-efficacy increases in this area, we see a lot of other affect be resolved, negative affect be resolved. This increases feelings of validation between people as well. So there are various types of groups, psychodynamic, experiential and relationship oriented, cognitive behavioral, and postmodern groups. And all of these have specific orientations. These are theoretical models, basically. But the group that I wanted to present to you today is an integrative approach. This is a model group design based on what was called a social and informational support group with mindfulness techniques for parents of children with ASD. I saw a presentation of this at the American Counseling Association last year. Dr. Kestenberg and Laura De Janeiro were our work at Malloy College, and they implemented a group therapy for parents at the Rebecca Center for Music Therapy. The Rebecca Center for Music Therapy is offers music therapy for children with autism spectrum disorder. And we'll see why this was so important in a moment. So, as with any group, right, one of the first steps is recruitment. In particular, in recruiting parents of children with autism spectrum disorder, you're really going to need to go to where these people are. In this case, you might want to advertise in target locations such as schools, the intermediate unit, occupational, physical, or speech therapy centers. You might want to go to doctor's offices. So you really need to put yourself in that mindset of where will these parents be? It could be the grocery store. You're going to put flyers, information in many different places. So intake protocol and screening, you're going to be talking to parents to see, there's a lot of issues involved in this, but I think for now what I want to just say is that will group therapy be something that's going to be beneficial for this parent? Are they open to perhaps meeting with and talking to other parents? The piece of this that has to do with realism is that many parents want to have support, but they are pulled in so many directions, and their lives are, the day is so consumed with care for their either one child or various children in their entire family, especially when children are at their young ages. The child with autism spectrum disorder may be with them all the time, or when they're not, there are many other things to do. So one of the most challenging pieces of this is actually um, being able to conduct the group at a time when parents can attend. So, a primary issue is childcare, as well as being aware of the variabilities in the group. So, it would be great to say, well, we're going to have a group of 8 parents who all have children with autism, um, who are between the ages of 0 and 3. But that might be more difficult than one would think. So, we'll go into this in a little more detail. So, some of the ideas for childcare, again, you want to be able to have parents access a group when they feel that their children are well cared for and that their attention does not have to be divided. So, some ideas for doing this might be, for instance, the model group that I am referring to conducted their group while children were at the music therapy group. Parents were waiting. They were in the waiting room. And so these two individuals thought, this would be a perfect opportunity to actually work with the parents who were waiting for their children to finish their therapeutic intervention. Other ideas, if you wanted to start a group, might be to contact your local counseling, psychology, or social work program. Looking for interns. Perhaps you could start a social skills group, an art group, a music group, something for children with ASD, and you could conduct parent group at the same time. Um, Another idea might be approaching a summer day camp. Often children during the school year might be involved in more in inclusive or mainstream programming, but in the summers, their families may be wanting them to find a camp where primarily there are children with autism spectrum disorder, so that they can have some time to focus on some very specific skills. This might be a great opportunity to find those parents and to see, well, while your child is in camp, perhaps you'd like to access your own growth and therapeutic group. The variations, the variability that I talked to, well, there's a lot that's going on here for both parents and the child. Again, it's very doubtful that you're going to have a homogeneous group of parents. So some of the things you're going to have to consider is the age of the parents, the age of when the child was diagnosed, if the parent receives respite care, whether the parent is working or staying at home and working, whether this parent is a single parent or is partnered, whether this parent is predisposed to negative affect and also bad experiences with service providers in the past. And there's going to be a great range of variability with the children of these parents, what their chronological and developmental ages are, how severe the diagnosis is. Recall that I said with increased severity of diagnosis or characteristics is generally increased severity of stress. There may be dual diagnoses, one of those medical co-occurring conditions that we discussed, or perhaps other psychiatric disorders. They're also involved in different ways with other services. So a lot of moving parts to this, a lot of variability. I will say in reflection, what was shared from the model group that I'm talking about today was that even though there was a lot of fear around the heterogeneity of the group, actually the group it worked well, because though this group was able to share in different experiences and both understand sort of what was distinct and what they shared, for some it was about looking forward and for some it was about looking back. So in a typical group session, this might seem a lot like other groups that you would be leading. But in this group, they started with introductions, would do a weekly update from each member, reflect about the previous session. This was just the general structure of the group. Talk about goals and hopes for the week, review homework, and then end the session with a mindfulness activity. Some of the themes that were generated in this group through sharing, well, as you can see here, they are vast. Isolation, loneliness, depression, fatigue, marital discord, embarrassment, weakened family unity, frustration, disappointment at self and others, finding acceptance, lack of social support, health issues, concerns regarding the future, anger, mistrust towards service providers and schools and institutions, lack of identity and loss of self, and grieving and loss of expectations for the child. And I think what's particularly important is that this group took the time to allow the group members develop these themes. These were not themes that facilitators sort of laid on the group. These were generated from the group. So here's an example, a little bit of processing here. The reflections that came up that had to do with the care of the child. It seemed so all-encompassing that the parents were losing a sense of self. This group did happen to be all women, and there was a lot of grief expressed not for what we often hear about, which is the loss of the dreams or expectation of who the child was, but it was really about the loss of who the parent was, describing how they had been as opposed to how they were now. And so the homework that was generated from that was to bring in a picture of the self before having the child and find 10 words to describe the self in the picture. And then the next week, find a current picture and describe those characteristics. So pre-motherhood, these women listed things like no anxiety and healthy weight, loving to go out and having fun, being carefree, strong, tough, young, athletic, daring, exciting, and happy. And again, this is their perspective on what they were. The perspective on what they were now was hopeless, helpless, weak, anxious, loss of self, unhappy, consumed by my child, uneasiness, restless, panic, unhealthy, obese, unhappy marriage, and exhausted. So some very difficult things to be dealing with, right? So what do we do with this? What's the point? It's good to share those feelings, but what were the goals that were being created from these responses? So the next step was to develop group goals based on these types of themes and shared concerns. For example, generating from that list of loss, the group was looking at, well, how do we increase sharing and empowerment? How do we decrease feelings of guilt and stress? How do we increase awareness and provide more adaptable coping strategies to deal with these negative feelings? Once some of these group goals were developed, the thought was, well, how do we implement these group goals? So one of the techniques was to reflect back. Were you always angry since you've had your child? Were there any moments of strength or happiness, of joy? How do you share information about what works for you? Could the group members share positive ways in which to think of themselves? Pulling in current events and empowering them with referenced research in terms of progress for themselves, progress for their children. Providing social supports, talking about not only providing social support within this group, but how could they enhance their social supports outside of the group? And role playing along with that, right? How do you approach perhaps grandparents or cousins or friends who you feel are not providing you with the support that you might need? How do you become more integrated into the community with your child with ASD? So working together to discuss how to implement these qualities, how to cultivate the qualities that they would like to see improved in their lives. And then, as I had mentioned before, each group session ended with a mindfulness activity, meditation, deep mindfulness breathing, guided imagery, trauma-sensitive yoga could be used, mindful eating. The point here is it's a bit of a psychoeducational piece, and that is helping parents to learn ways to reduce their own stress with the hopes that they might take this outside of the group, but definitely implementing that at the end of each group. saying goodbye, right? One of the most difficult pieces of all groups is to terminate the group. Um, at this time, the facilitators took time to talk about the past and the present and the future and to reflect on positive growth that might have been shared, to encourage the continuation of the mindfulness exercises. And the counselors sent a certificate of participation, which I think, was a very important piece probably for the members of that group who struggle so to get things done and accomplished, and to see that they actually had participated in a group and had finished the group, had met with these people, and had dealt with a lot of these issues that were stressful for them. So, in conclusion, I would like to just say that parents of children with ASD experience stress at high rates, and they're also resilient and responsive to social support. Group therapy can be an effective and meaningful way to provide the care they need. Thanks.